Welcome to the weekly press briefing here for Cole County. I'm Christy Campbell, the director at the Cole County Health Department. I'm happy to report that our case numbers continue to be low. We've been in for quite a few days now, and it's very encouraging to see that. It's very encouraging to hear that our hospitalizations have also been lower, and I'm sure that the hospital organizations can cover that. We are also encouraged to see our vaccination rates increasing. I checked this morning, it looks like Cole County is at 15% of our population who have received at least a first dose. We are still asking everyone to continue to practice those precautions and, of course, to have patience because our vaccine supply is still low. I am very encouraged that there will be another vaccine coming on in the supply chain very soon. And I'm hearing that we will hear some news very soon about how that vaccine will be distributed and how it will increase the total number of vaccines that are coming into Missouri. I'm very encouraged by that. And I think that will help all of our organizations to provide more vaccinations within our community. I do want to emphasize the importance of getting that second dose, making that second dose appointment when you get your first dose. It's very important that you get the same vaccine as your second dose as your first dose. If you get a Pfizer vaccine, you get that second dose of Pfizer in 21 days or as close to it as you can. Moderna, 28 days as close to your can. And to go back to that organization, if at all possible, that gave you that first dose, because we've talked about before how the vaccine that we're dealing with is not like any other. We can't just go to the refrigerator and pop out a dose of this like we do with flu vaccine. Once you open the dose of the vial with like Pfizer is 6 doses, Moderna might be 10 or 11. They all have to be used within 6 hours. We can't just put it in the fridge and hold it for you till tomorrow. And with the way the supply is, for a while we are getting Pfizer, now we are getting Moderna. So it's very important to go back to that provider that you got your first dose from, make that second dose appointment, keep that appointment, and make sure to follow through with that. The last thing that I wanted to talk about was the second dose event for our at the link that our National Guard supported event. It is tomorrow, 8 to 4. Everyone who came on February 5th should come at the same time as they can tomorrow or as close as they can. They will need to bring the white immunization card that they received that day, and the second dose will be recorded on that card. If you did lose it, we will have some there, and we will have someone checking for that first dose, and we'll record that information on the card and be able to provide you the second dose. You do have to provide another consent form. Each time you get a vaccination, you have to consent for the provider to give you that immunization. And we do need you to provide another form tomorrow and to please bring your photo ID. It will be set up very similar to the way it was 3 weeks ago. We will have a few more staff at the front to be able to check the state's database and provide those cards if needed. Otherwise, it will be set up very similar. We will be doing the 72 appointments every 15 minutes and hope to vaccinate those same 2,000 people again with the second dose as we did with the first. So with that, I think we will move today, and we will have Cap Regional Medical Center, Dr. Haight.
Hello, everyone. Capital Region continues to have a lower number of patients in the hospital. So for the past 2 to 3 weeks, we've had 1 to 5 patients almost every day with COVID. If we remember back to November, that number peaked at about 45 for our institution. So the absolute number is tremendously down. We also are noting that the number of tests being performed in our outpatient clinic area has also decreased. And the percent positive of those lower number is about the same. So that leads to an overall decreased number. We are watching because the Super Bowl, as you remember, was a week and a half ago. And so we're seeing if that will have any influence on the rest of this week and early next week, because this would be the time that we would expect those more severe cases to be in the hospital. One of the things I would like to cover today is just, as Christy mentioned, there is a new vaccine that will likely be approved. It goes before the FDA tomorrow, and that's the Johnson & Johnson vaccine. It is a 1-dose vaccine versus the Pfizer and the Moderna, which we currently have which are 2 shots. The Johnson & Johnson is 85% effective preventing severe disease and was 66% in preventing symptomatic disease. If you remember, Pfizer and Moderna were 95% against symptomatic disease. So one of the questions that I expect that we'll have is that if they call me about Pfizer, if they call me about Moderna, or if they call me about Johnson & Johnson, doctor, what would you prefer me to do? And I will tell you, I probably speak for everyone, but I'll let everyone speak for themselves, that whatever shot that they call you about, please get the shot that they call you about. So if you get a call about Moderna, please get it. And remember to get the second shot the same way with Pfizer. If they call you and say they have Pfizer, please get that shot and then get your follow-up. If they call you and say we have Johnson & Johnson, please get that 1 shot. We will likely have further vaccines available in another couple of months, but these will likely be the 3 that we have. And you will probably find out as we do the distribution, as Christy mentioned. We'll hear about it, and I will tell you we have a great regional team that works together. We meet 2 or 3 times a week virtually to go over who has what and where can we most effectively use the vaccination. So again, those are just a few of the things I had to share today. Thanks.
Great information. Dr. Adams with SSM St. Mary's.
Good morning. I'm pleased to share that we only have 1 active COVID case in the hospital right now. And we likewise have been seeing a decreased demand for testing because lower symptomatic people in the community. So evidence that the virus has slowed its spread in our area. So we're very encouraged by that. Please do continue to practice your social distancing, and please, I think the most important thing is if you don't feel well, stay home, just to make sure not to spread any viruses or other illnesses. I agree with Dr. Haight's recommendation to get the vaccine that's offered to you, regardless of manufacturer at this time. The reason is that we just don't have enough supply to meet demand. So if you're offered one and you want one, I think that you should probably go with the one that's offered to you, because it's hard to say the next time that it would be offered. I did get a question in the community, someone who felt that they've been on the waiting list for a while and had not received a call. If that applies to you, you might call and make sure you're still on the waiting list. I don't know if they couldn't get a hold of you and maybe they assumed that you didn't want the just call and make it and confirm that you're still on the waiting list if you haven't been called, because we've pretty much been getting through the waiting list calling people. So, and also I just wanted to remind you that if you are suffering from long-term symptoms of COVID, from an illness that you had, please seek care with your doctor. Let your doctor work with you to alleviate your symptoms and get you to feeling better sooner. And that's all.
Thank you. All good points, Dr. Adams. Dr. Sullivan from the Community Health Center.
Good afternoon. We have continued to administer vaccines as the other facilities have done. We did have a couple of vaccine events last week that we rescheduled to this week, and we have been able to get through those events already. We did go to 2 of the low-income senior housing apartment complexes yesterday to administer vaccines there, and we are continuing to work with United Way agencies to get additional vaccines administered to some of those that may not be able to make it to our clinics. If you are interested in getting signed up for a vaccine, like Dr. Adams had talked about, if you haven't heard back yet, call and let us know. If you're a patient of any one of our organizations, contact us, make sure we've got you on the list. If you don't have a PCP, you can contact the health department, or you can contact the community health center, or any of our organizations to establish care. In addition, you can go to the mostopscovid.com website that Christy showed last week, or you can also get to that by going to covidvaccine.mo.gov. And there's a link for the vaccine navigator, so you can sign up through that for those mass vaccine events. You can also call 877-435-8411 if you don't have access to the internet to get signed up through that as well. The Community Health Center is also hosting another free COVID testing event. We had one that was canceled because of the snow. So we are doing one next week, March the 3rd, 9 a.m. to 3 p.m. at the American Legion. And this is open to all Missouri residents. You don't need to have a physician order to be tested, but we do recommend that you register in advance by going online at health.mo.gov/community-test. Or if you don't have the internet, you can call 919-351-6256. And that's all that I had.
Perfect. Thank you, Dr. Sullivan. Also on the MoSTOP's COVID or covidvaccine.mo.gov website, the retail organizations that are starting to have the vaccine are going to start to be listed. So there's a map in Missouri. You can zoom in to your area and see what retail organizations will are starting to carry the vaccine as well. So it's very encouraging that we're having more providers to share in vaccinating all the residents. So Ron with JCMG.
Good afternoon. So JCMG continues to vaccinate patients with first doses and second doses. We too have seen the decrease of patients that are seeking testing in our facilities. Definitely have switched to the vaccination process. I'd like to reiterate what Christy mentioned earlier about that second dose. If at all possible, please try to keep that appointment scheduled for your second dose. We're receiving numerous phone calls of patients wanting to shift that several days, and that can just create some challenges when it comes to making sure we're really getting all of those doses out of the vials. And so we definitely want to encourage patients to make sure they're keeping those appointments as scheduled. Typically moving around in the same day is not an issue. You want to come earlier, come later, we can usually work around that. But if we're talking about different days, that creates a different logistic challenge. We also would recommend, as other physicians have, to receive the vaccine that is available to you at that time. I've been personally making phone calls to patients today, and I've received several questions about, well, I'd like to receive the Moderna or the Pfizer or the Johnson & Johnson, and at this point, it's what we have and what we're able to offer to you, and we would encourage you to take the vaccine that we do have as a means of being vaccinated. Like Dr. Haight mentioned as well, we don't know always when we're going to have the next round of vaccines due to the limited supply, and we'd like to get you immunized with what we have currently available.
Thank you, Ron. Commissioner Bushman.
I'm going to do my logistics again because that's what Christy told me to do. Tomorrow is our second clinic. This is for the people who received their first vaccination on February 5th. So if you were vaccinated on February 5th, come tomorrow. As we told you before, parking's kind of at a premium. So come 15 minutes before your appointment. You don't need to be there a half an hour, 45 minutes before. Come 15 minutes before. The National Guard will help you find a parking space. If you are the only one getting the vaccine, we don't really need your spouse or your family with you unless they're your caregiver. So just come in and we will get you in and out of there very quickly. As Christy said, bring your appointment card, and if you can, print off the registration sheet again, because you'll have to have that signed on the front and back. I know that from that. And the weather's supposed to be nice again. You know, we've been very, very lucky on our weather. So everybody who was vaccinated on the 5th, come out tomorrow. We'll get you done, and that's it. We will be having a press conference at 7:15 a.m. So the TV stations, radio, newspaper, if you want to come out at 7:15, you know, we will kind of let you take pictures of the setup. Once we get started, we can't, because of HIPAA laws, we can't have you there. So come on out at 7:15, bring donuts, and see our operation, and we're moving ahead.
Thank you, Sam. I meant to mention earlier, I wanted to thank all the organizations that are participating. Of course, the City of Jefferson and Parks and Rec and Lincoln University for the use of the link. The Capital Region Medical Center, SSM St. Mary's, JCMG, the Community Health Center of Central Missouri, the Cole County Health Department, Cole County Emergency Management, Cole County EMS, the Lincoln University Police Department, Jefferson City Police Department, Jefferson City Fire Department, and a special thank you to Central Bank. Their staff called and made appointments for us, and then they were gracious enough to call this week and make those reminder calls and reach everyone to remind them about their appointment. And then the United Way, they provided water and snacks and lunch for all of the staff last time, and they're doing that again tomorrow. And that is a huge help to all the staff that are working there and all the volunteers. So we really appreciate those community partners stepping up and being a part of this event for our community. So Mayor Turgeon.
Thank you. And I want to just encourage everyone to follow the guidance that Dr. Sullivan put out about following those steps so that you can get on the vaccination list, so that when you are eligible, that you are ready to be called, and make sure that you follow those steps that she outlined so that we can get everybody on the list and ready, because we know that this is going to take some time before everyone is eligible. So just make sure that you do follow those steps that Dr. Sullivan put out. Also, if you haven't already been following the Cole County Health Department on their social media, they've been putting out great guidance. Recently, they talked about the fact that you shouldn't take pain medication before your vaccination, and other helpful tips and advice. So please follow that and share that as much as you can with others. And then lastly, as a city council, we've been being a good example by meeting virtually. And as we transition into meeting in person around mid-March timeframe, that you'll see that we'll still continue to be spaced out, that we're having those 6-foot areas of space between council members during our meetings. So as you see us transition, we hope that you'll also transition by continuing to take all of the precautions that are necessary and continue to follow them, along with having patience. Thank you.
That's great information, Mayor. Thank you. So at this time, I would open up for questions unless there was anyone from the group that forgot something and wanted to mention it.
This is Dr. Vaughn. I have a couple of questions.
Sure.
Thank you, Dr. Sullivan. For first, I appreciate these weekly briefings. They're really very, very helpful. But I have a couple of questions. Have you all talked about perhaps conducting a town hall meeting to talk about vaccines in general? Because you still have a lot of hesitancy about getting the vaccine. There's a lot of people in the community, or they just, whether it's available or not, they don't want to get the vaccine. So Columbia did a town hall last night, was really good. And they had 2 doctors, they had a couple of nurses, a med student. And so they allowed the community to come in and ask them questions about the vaccine. And most of the questions was focusing on hesitancy. Why should I get the vaccine and things like that? So I was just wondering if you all have talked about doing anything like that.
I'll probably let Dr. Sullivan weigh in on this too, but we have talked about ways that we can get the word out. I think we have actually been hesitant to have a town hall meeting because we've been trying to avoid having large groups of people come together for obvious reasons. So finding a venue that's appropriate for that and making sure that we do it in a safe way would be very important.
It was on Zoom. They did a Zoom call.
Oh, it was a call. Okay.
Yeah,
well,
they,
yes.
they did a Zoom call, and
Good.
Yeah, it was really good.
Good. And they just opened it up to the public?
Yes, they opened it up to the public. I actually posted on the NAACP Facebook page, and I sent it to a couple of people on their Facebook page. I have Facebook, but I'm not a Facebooker person. And so they posted it as well, and people were asking really intelligent questions, and it was from 6 to 7:30. So, yeah.
Well, that sounds like a great idea, and I think that's something that we can explore within our group that meets twice a week. So, Dr. Sullivan, did you have anything to offer, or we can talk about how we can do that here for the Cole County community?
Yeah, I think that's a great idea. I hate, and I don't know if you want to speak, but I think you did do something like that in affiliation with MU also, if you wanted to speak on that.
Yeah, so MU and Capital Region, along with KRCG, did have an event a couple of weeks ago in which, again, we went over vaccine. But again, as people have more questions, as things become available, we can always we discuss and try to have other avenues to reach out to people as well.
And what they stressed is the meeting was focused on the vaccine and not the distribution of the vaccine, but general questions about the vaccine.
Right.
That sounds great. Thank you.
And then that leads into the next question about a campaign. What are you all doing in terms of campaigning, especially for individuals who, it's mentioned, several of you all mentioned, who don't have access to the internet and things like that. And I know the United Way has been mentioned, but have you all actually developed a campaign?
We have been working on that. We hired a part-time health educator here, and we also have access to all the state resources because they have a huge campaign that is focused on getting the information out. And we also belong to several organizations individually and collectively that also have information that work to get it out. So I'll let some of the other physicians speak as well.
Yeah, and we're doing some smaller individual kind of sharing a message with smaller groups of individuals as well. We started with working with United Way as a way to kind of reach out to some of those individuals that we may, really need to provide additional education to, and some flyers. So we are working through those United Way agencies for those smaller groups. But I think, like Christy said, continuing to use the information the health department's putting out and that the state has, we can continue to do that as well.
Thank you. Are there any other questions for the group?
Christy, Megan Dracus from ABC 17 News. I was just wondering, I think this would be a question for you. How many people in Cole County are currently eligible to receive the vaccine, and what percentage have actually received a dose?
I don't think that we have been provided the total numbers of that yet. It is very hard to calculate the number of individuals from 6 to 64 that have those underlying health conditions. I think individual hospitals have been able to query their systems and determine how many patients are over 65. That number is a little bit easier to capture. But all of our vaccine data goes into the Show Me Vax registry, that is the state database, and that information is provided to us off that state website, that covidvaccine.mo.gov data table. That's the information that we're also provided. Is anybody else receiving any specific data from other organizations?
And just kind of a follow-up for that, I know there is talk that the governor might announce another tier of eligibility. Would you as a county feel comfortable moving into the next tier of eligibility?
I think we would collectively work with our hospitals organizations to determine where we are with our current tier, given their database of patients and where they are with their waiting list. I know we've been working down our waiting list. The biggest barrier to moving to any additional phase is the amount of vaccine. It doesn't matter how many tiers are open. If we don't have the vaccine, we can't do anything. We've had several meetings with our teachers, and we've talked about how we're going to get them vaccinated, how we're going to do it, what staff are going to work it, how we're going to get it done. But until the tiers open and we have enough vaccine, we can't do that. So we are all collectively as a group working through our list and trying to do the best we can. But until that vaccine supply increases, there's not much we can do. Does anybody else have anything to offer?
Thank you, Christy.
Any other questions? No? Okay. Well, thank you all, and we'll continue. And for those that you want to join us at 7:15 in the morning, we'll see you at the link. And have a great weekend.